there is a shortage of black practitioners. Blacks make up more than 13% of the U.S. population, but only 4%. Just 4% of the nation's doctors. In his new book, it's called Black Man in a White Coat. Love that title. Dr. Damon Tweedy looks at how that gap harms black patients and how everybody can navigate the healthcare system regardless of your skin color. Dr. Tweedy is an assistant professor at psychiatry at Duke. Good morning to you. Charlie says hello because, you know, he loves all things Duke. But this is the thing. I read your book. It was Labor Day. I was taking a break. I wasn't going to exercise. I read this book. I said, I better get my butt on the treadmill today because you say this. Race is a very big deal when it comes to health. And certainly when it comes to blacks, it's worse for minorities. Why is that? Being black, you said, you actually say being black is bad for your health.
Yeah, so there are all sorts of statistics and studies that highlight this, but my book takes a really personal approach to it. So I think a really good example is early in medical school, I was out in the community. We rotated to this community about 90 minutes away. It was a volunteer clinic, and the patients there were all black. Most of them did not have health insurance, and it was pretty clear from the very beginning that we couldn't provide the adequate care to them. They couldn't afford the medications, the lab tests, and the other treatments that they needed. Another time I was in an inner city emergency room clinic and saw the same sorts of problems. And it all kind of crystallized to me one day. We went out on an ambulance to this community. It was a really isolated, horrible housing project. And you could, all around you just saw illness. You saw obesity, you saw addiction and violence. And
high blood pressure.
Exactly. And it was as if the people there were cut off from the rest of society, even though the outside world wasn't that far away. So my story really illustrates in a personal way this problem that we have.
How about your own experience? I mean, this is the title, as Gail said, it's a very catchy title, Black Man in a White Coat. How have you been treated?
Yeah, there are a couple examples in the book that I talk about. So I think the first one that really stands out, this is at the beginning of the medical school. I walk into the classroom, and then there's a professor who comes up to me in a sort of angry way, and he mistakes me for the handyman. So he thought that I wasn't doing my job. And so it's a really bad case of mistaken identity. And then there was another...
What did you say? What did he tell
he asked me, he said, are you here to fix the lights? And you know, I asked you to do this last week. Why haven't you done it yet? So it was a horrible case of mistaken identity. And then there was another example when I was a brand new doctor. A patient came into the ward, and he was admitted to our team, and he used racial slurs to indicate that he did not want a black doctor. So in the book, what I do is I try to highlight how I learned from these experiences and really sort of tapped into an inner resilience and self-confidence that I didn't really think I had at that time in my life. And in the case of the patient, I was actually able to connect with him and actually him and his family as he was facing death. And it was really in the most improbable ways given how we initially interacted.
But you had both black and white patients that didn't want a black doctor, Damon.
Yes. So that same year, I actually had, exactly, yeah. It's a very good point. And I had a black patient who sort of was under this mindset. He grew up in the era of segregation and under this mindset that whatever was black was less than adequate.
Not as good.
And so he came with that attitude. But at first, again, I was taken aback. I certainly was familiar with that attitude, but I was taken aback. But I really had to dig deep again and show him that I could do this.
I'm qualified.
And then at the end, he actually gave me the highest compliment a patient can. He said, "Well, I'm really sorry about all this, and I'd like for you to be my doctor."
Yeah.
We also have a black doctor running for president in Ben Carson. He's a role model for you. What do you think about his campaign?
Well, there's no doubt that Ben Carson is a role model to a generation of African American physicians, me included. There's no doubt about that. As far as the political side of things, I think however you feel about his campaign, I think it's really important to have physicians in the political process. I mean, healthcare is important to all of us. And the idea, and doctors, we're in the place where we are front and center, and we see people in the real world. And so I think it's a really valuable perspective to add to the political dialogue.
But you've gone from 17 years to an insecure medical student to now on the faculty at Duke. Yes. And the change, congratulations.
And author.
And
best-selling author.
Yes, and best-selling author. Black Man in a White Coat. And the changes that you've seen, do you feel better about when you started?
I think there's been a lot of progress, but there's still a lot more to do. And I think the book really talks about how all of us have a role to play in that. The healthcare system, doctors have to work hard to connect with patients, and we as patients have to take more ownership of our own health. So all those things have to happen.
And we need more good mental health professionals like you.
There's no doubt about that.
Thank you so much, Dr. Damon Tweedy.